I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're highlighting a fight in the state budget over a proposal from the governor that would curtail Medicaid coverage for a cancer screening tool designed to inform a patient's care. To make the case for holding the line on the availability of coverage, we're joined in the Capitol Press Room by Michael Davoli, the Senior Government Relations Director for the American Cancer Society Cancer Action Network here in New York. Welcome back to the show, Michael.
Thank you, David. Good to see you again.
Good to see you. So unless someone has battled cancer before or they work in oncology, they probably don't know what biomarker testing looks for or how the information is used. So can you walk us through the application of this tool in terms of helping craft a treatment plan for an individual?
Sure. Historically, the way we treated cancer was you sort of blast it with chemotherapy and that you hope that it kills the cancer without doing too much damage to the patient itself. That's the way we've treated cancer for generations now. Now we are in a time of where we have precision medicine, where we can really figure out what type of cancer treatment is going to be best for an individual patient. So you may have two different people with breast cancer, but their diseases may be so different. And so different treatments are going to impact each of them differently. And so biomarker testing is a specific test of a tissue sample, of the actual cancerous sample, to determine the very specific mutations within that person's cancer, to figure out what makes their disease unique to them, and therefore informing what care is going to be best for them. So almost all of precision medicine these days, not just for cancer, but other diseases, involves this type of precision medicine, and biomarker testing unlocks it. Over 60% of all oncology drugs that are coming onto the market in the past 5 years all require biomarker testing in order to have access to them. And so that's why it's so critically important that we are testing people, testing their biomarkers to figure out the best course of care for a patient.
So it was only in the last couple of years that the state approved legislation requiring health insurance policies and Medicaid to cover biomarker testing for certain purposes, like this idea of crafting that specific plan for cancer. What does the status quo look like right now in terms of coverage, whether you have maybe a private plan that's regulated by the state or a state government-run plan?
Yeah, it was literally just over 3 years ago. I mean, it was June of 2023 so not even 3 years ago, June of 2023, when the state legislature passed this law, bipartisan, unanimous in the Senate, one no vote in the Assembly. Don't ask me who that is because I put it out of my memory. What literally bipartisan, near unanimous bill in both houses passed in June of 2023, which required all state health plans in New York, including private as well as Medicaid, state-regulated health plans, to cover the cost of biomarker testing for patients when medically necessary. And it set into law very specific criteria for determining that. So it's not just, hey, some run-of-the-mill doctor decides they want to prescribe a test or any test could be used. There's very specific criteria. For example, if that test is covered already by Medicare or Medicare, it's appropriate. If it's FDA approved, it's appropriate. If there are nationally recognized clinical practice guidelines, it would be appropriate. To ensure that this testing is being done only when necessary, but also when appropriate and not abused. Now, the governor signed the bill into law in December of 2023, only after insisting on a chapter amendment, that thing that the governors like to do in New York State, signing this chapter amendment, adding an additional piece of criteria to that current law at what's called peer-reviewed evidence. Essentially, she made the law even broader. Now, this was not something that we advocated for, but it wasn't something we were objecting to. So that put the law in place as of January 2024. Now, fast forward to the current executive budget. In her budget, she has proposed to roll back all of that criteria And instead of following all of these sort of national criteria, they want to simply let the Department of Health make the determination of when it's necessary and what is to be covered. And the ironic part is on the February 10th health hearing, Health and Medicaid, the Medicaid director was asked specifically about this and about why the governors put this language in there. And the Medicaid director specifically said it was this peer-reviewed evidence language that was causing problems. And that was at the root for why they needed to change the law. And so that's where we are here. And our perspective on this is we could resolve this right now. We could just amend the law, remove the peer-reviewed evidence language, and go back to the language that was originally passed by both houses, and we would be done with this. We wouldn't have to continue to have this fight. Doing that would ensure that biomarker testing continues to save lives and also reduces long-term healthcare spending.
Well, what do you anticipate would be the practical effect of implementing the governor's proposal, which, as you said, would allow for Medicaid to cover this testing when deemed medically necessary by rules and regulations from the State Department of Health?
So this is the really important part. Right now, the current law covers both state-regulated private insurance plans as well as Medicaid. The governor's proposal wouldn't touch any private plans whatsoever. It would only limit access to Medicaid plans. So someone who is has a private insurance plan would be able to get the best access to biomarker testing when they need it to treat their disease.
Well, assuming they could pay for it out of their pocket.
Well, but biomarker testing is covered. That's what I'm saying.
With no out-of-pocket costs?
No, there's no out-of-pocket cost for biomarker testing because that's the insurance plans are required to cover the cost of it. I mean, yes, there could be, co-pays, co-insurance, whatever your plan.
Yeah, I mean, but a lot of people's insurance plans, that might make that type of thing cost prohibitive.
Yes, of course. But the difference is, though, it's paying for some aspect of it, as opposed to up until this point, insurers did not have to cover it at all. Mm-hmm. And so many insurance plans covered it already. Many insurance plans did not. Now, juxtapose that with Medicaid. Under the current law, Medicaid is required to cover. The governor's proposal would say that Medicaid would no longer be required to cover it unless the Department of Health makes the determination that they should. So you are effectively creating a two-tier system where Medicaid patients have limited access to this life-saving testing versus commercial plans, and people who have commercial plans are going to have access to this. This two-tiered system is really going to sort of fracture our healthcare system and really exacerbate all of the health disparities that already exist and lead to worse health outcomes for people on Medicaid.
I mean, that's emblematic of our healthcare system more broadly. For example, if you are on Medicaid and you're trying to go see a dentist, they're probably not going to take you. Whereas if you have private dental coverage, they will take you. So in a state where we do have to make choices because we don't have some sort of single payer health insurance system, why is this one of those areas where we should pony up to pay for this coverage as opposed to a variety of other Medicaid costs?
Yeah, and you're absolutely right. I mean, we have huge disparities in our state. If you are a Black woman in New York State, you are less likely to be diagnosed with breast cancer, but you are more likely to die from breast cancer because of many of these health disparities. And what we did in 2003 by passing this biomarker law and enacting it into law, what the governor did by signing into law was take a big step towards closing some of those disparities. Now, don't get me wrong, I'm not saying it's not a panacea where we're solving everything, but you're taking a big step in terms of closing some of those disparities when it comes to treating cancer and other forms of disease. What we should not be doing is going backwards and literally just blowing the doors wide open and exacerbating these disparities by going backwards. Now, you mentioned the dentist. The difference between dental care versus oncology, right, is one of them is about life and death. And we need to be investing in programs that help people survive. And biomarker testing is not only saving lives, but it's also going to reduce long-term healthcare spending. Because if you look at what I said in the beginning about the way we treated cancer, it was kind of like throwing spaghetti at the wall and you hope it sticks. And this trial and error approach very often is a complete waste of money, because you sometimes are using a treatment on a patient that a biomarker test would show never would have worked in the first place. So instead, using precision medicine through biomarker testing, we could figure out, okay, this treatment for David Lombardo is not going to work, but this treatment for David would actually work, and therefore avoiding wasted dollars when we're treating patients. Bottom line, though, is that we should not be balancing the budgets on the backs of cancer patients and others battling disease. Yes, the budget is difficult. Don't get me wrong. I understand that. I work with Medicaid and advocating on all of these issues, but we have an opportunity to ensure that we continue to treat people and close some of these disparities. And we should not be going backwards at a time when the federal government is already making it difficult on us. And that is what our plea is to the legislature, that we can make changes, like, for example, the peer-reviewed piece. We can address what Medicaid has directly said, and we can remove that language. And that is a compromise that I believe both houses would get behind, because that was what was in the original law that was passed. And we don't need to continue to have this fight.
Well, coming back to that practical impact question, though, I mean, the governor and their narrative is that they're allowing Medicaid coverage of this just when it's medically necessary. But at the same time, they're estimating cost savings of $50 million, which is well in excess of the initial costs related to the rollout of this program, which seems to call into question how widespread or available these services would be in the future. But do you have any sort of best guess, or is it kind of a black box when it comes to who would and who wouldn't be able to access these coverage if you're on Medicaid moving forward?
Yeah, and look, that is the fascinating question, because I read every article, I follow the news all on this, and there seems to be no willingness to share from the state as to how much money they're actually spending on biomarker testing. Here's what we know. The DOH and the budget team, they forecasted $15 million annually when this was fully implemented. Now they're saying that this would save over $50 million. The only way that is actually happening is if they plan on rejecting biomarker testing almost entirely to Medicaid patients. It's the only way that they could save such an enormous amount of money. If they are spending $150 million on biomarker testing and limiting it a little bit would save $50 million, then they should come forward and share those numbers. But if they're not willing to share exactly how much is being spent, but they are arguing that it would save $50 million, then they must be intending to limit it entirely to Medicaid patients. And that, as I said, that would just be bad for public health, and it would be bad for the state's long-term financial picture.
Well, we've been speaking with Michael Davoli. He's the Senior Government Relations Director for the American Cancer Society Cancer Action Network here in New York. Michael, thank you so much for making the time. I really appreciate it.
My pleasure. Thank you, David.
Fraud and lawsuit abuse raise car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact, but some Albany leaders want to keep the status quo. Information on these reforms is available at keepnewyorkaffordable.org.